Good afternoon, everyone. So yesterday we have completed about the surface anatomy upper limb. So only I have discussed bony landmarks. So today we are discussing about the muscles. Means what are the individual muscles or different group of muscles. So how to differentiate or we can how to identify on the surface itself. Okay. So today's topic is the muscles, nerves and vessels. So these are the structures how to demarcate on the surface of the body. Okay. So coming to the muscles, see here the picture is showing the arm and the shoulder. So what happened here, you see when the arm is abducted against the resistance. Adducted. See from the abduction, if you adduct the arm against the resistance, then you will find out well demarcated anterior axillary fold and posterior axillary fold. So what happened here? The muscles which are contracted. So what are those muscles contracted and forming these axillary folds? Okay. So coming to the anterior axillary fold. So this anterior axillary fold, it is well prominent here. Have you appreciated? So this is a prominent anterior axillary fold. So when you can appreciate while you are adducting the limb, means arm, when you are adducting the arm from the abduction to adduction, that is a movement. What is that? From the abduction to adduction. So against the resistance. So then you can appreciate these folds. So here the anterior axillary fold is formed by the lower border of the pectoralis major. So what is this pectoralis major? So lower border means means towards the insertion, what happened? The tendon is twisted, as you know already in the dissection. So what happened towards the insertion of pectoralis major? The lower border is twisted. So by the twist, what happened? The upper fibers of the pectoralis major becomes lower, whereas lower fibers of the pectoralis major become upper. So here the anterior axillary fold is formed by the lower border of the pectoralis major muscle. And the bulkiness of the anterior axillary fold, it is formed by the, means along with this pectoralis major, beyond that means just beneath that pectoralis major, there is pectoralis minor. So these two muscles are creating this anterior axillary fold. Okay. Then posterior axillary fold. Here this posterior axillary fold. See, cursor is showing posterior axillary fold, which is formed by the latissimus dorsi medially and teres major laterally. Okay. So in the anterior axillary fold, in addition, what is that other muscle? Pectoralis minor. So when the arm is raised, the lowest slip of the origin of pectoralis minor produces the fullness just below the anterior axillary fold. So the fullness of the anterior axillary fold is because of the pectoralis minor. Okay, and the origin of serratus anterior also, it causes a very characteristic surface marking. Here it is not clear, but see the serratus anterior causes very characteristic surface marking. So when the arm is abducted, the lower 5 or 6 serrations. How many serrations for the serratus anterior? Altogether 8. Okay, so out of 8, the lower 5 or 6 serrations are forming a zigzag line with the general convexity forwards. So if you see the thorax, means trunk, on the surface, there is a zigzag line with the contraction of the serratus anterior. So when the arm is abducted. Then see deltoid. So this is the posterior aspect of the shoulder. So if you see, I identify clearly the shoulder. The summit of the shoulder gives a rounded appearance. So this roundness of the shoulder is because of a muscle. So what is that muscle called? Deltoid muscle. So with the help of 3 sets of fibers, see posterior fibers from the spine of the scapula, the intermediate fibers from the acromion of the scapula, the anterior fibers from the clavicle, later 1/3 of the clavicle. So all these fibers together form a summit on the shoulder. So this bulky rounded elevation on the summit of shoulder because of the deltoid muscle. Okay. If you want to abduct the arm from the side of the trunk, If you abduct the arm, what happened? There is a bulkiness over the summit of the shoulder. That is because of the deltoid muscle. Okay, and of the scapular muscles, so many muscles are there here on the dorsal aspects. What are those muscles? Supraspinatus, infraspinatus, teres minor, teres major. So out of all scapular muscles, one muscle which is forming the influence on the surface. So what is that muscle? Teres major. So here this teres major is forming the posterior axillary fold. Then on the back of the arm, if you identify on the back of the arm, all of you observe the back of the arm. So this is the posterior aspect of the arm. So on the posterior aspect of the arm, the long head of the triceps brachii, it may be seen. See, this is the long head of the triceps brachii. And these are the margins of the deltoid along the posterior margin of the deltoid. If you see the exit, means entry of the long head of the, what is that long head of the triceps brachii, it passes beyond that. Then after contraction, see, by its contraction, you can able to identify other two heads of the triceps brachii. See, on the lateral side of the long head, there is a lateral head, and the medial side, medial head. So these three heads are fused to form a flat tendon and is going to insert olecranon. Okay. So how to identify? First, you have to appreciate the posterior margin of the deltoid. Beyond that, you can identify the passes of the long head of the triceps. Okay. Then just either side of this long head, lateral and medial heads gets fused with this triceps, then it forms a flat tendon. So this is prominent, see, on the back of the arm. Now coming to the front of the arm. So on the front of the arm, what muscles you can expect? Biceps brachii, coracobrachialis, right? And brachialis. So how to determine these muscles? For which you have to flex your elbow against the resistance. Okay, just you try to yourself on your own arm. See, just you flex your elbow against resistance. Okay, you must follow this. What is that? When elbow is flexed against resistance, not simply elbow flexion. Okay, it is against resistance. If you flex the elbow, you can demarcate a very prominent structure on the front of the arm and particularly on the medial aspect of the arm. So that is the biceps brachii. Okay, if you keenly observe this biceps brachii prominence, medially one groove and laterally one groove. So what is that? Intermuscular grooves. That is where the intermuscular septa gets attached to the humerus. So either side of the biceps brachii prominence, we have two depressions, medial and lateral depressions, right? Then on either side of the biceps brachii, at the lower part of the arm, brachialis is discernible. If you see, that picture is not available, so that's why I kept this picture. If you identify very clearly, see here, this is the biceps brachii, okay, and this is a groove. So beyond this groove, in the lower part, means in the lower 1/3 of the arm, you can appreciate the brachialis, because the brachialis takes origin from the anterior and adjacent medial and lateral surface of the humerus, right? Then when the arm is raised, the coracobrachialis reveals itself as a narrow elevation, okay, from where it is emerging. So it is emerging from the anterior axillary fold, then running medial to the body of the humerus, like this. But here that coracobrachialis is not that much prominent because this is a flexing of the elbow against resistance. But if you just raise your arm, then coracobrachialis can be easily identified. Okay. Now coming to the front of the forearm. So on the front of the forearm, you see picture showing the four fingers, the medial four fingers obliquely crossing the front of the upper part of the forearm. So here, why I am showing only fingers? Because these muscles are not producing any prominences. Only the tendons can produce is very prominent on the front of the wrist. So, elevation forming the lateral side of the antecubital fossa. If you identify, this is the cubital fossa. On the lateral side of the antecubital fossa, there is a slight elevation. Have you appreciated this elevation? So, this elevation consists of brachioradialis and extensors, then supinator. So, all these three muscles here it is forming. Because extensors, why I am telling this bulky containing extensors? This is a common origin for the superficial extensors of the forearm. So what is the common origin? Lateral epicondyl. So that's why there is a bulky prominence on the lateral aspect of the cubital fossa. So what is that bulk consisting? The brachioradialis, extensor, that is superficial extensors, and the supinator. Okay. Then coming to the flexors. So here the muscles are not prominent, as I told earlier. See, the tendons only we can identify. But here you see the flexor digitorum. This flexor digitorum does not directly influence the surface, but the position of its four tendons on the front of the lower part of the forearm. Here you identify. All of you see the lower part of the front of the forearm. There is a slight depression. If you see that structure just lateral to this depression, see, this is a depression. So, what is the depression? The position of its four tendons on the front of the lower part of forearm is indicated by elongated depression between tendons of the palmaris longus and flexor carpi ulnaris. See the depression, and most medial structure means that is nothing but medial border of the forearm. If you see, the entire medial border of the forearm is occupied by one muscle. What is that? Flexor carpi ulnaris. Okay. So, if you want to identify these tendons very much prominently, just you should flex your wrist against the resistance. Again, I will show you in the next slide what are those tendons, how to appreciate. First, in this slide, you identify just above the wrist crease, there is a longitudinal groove. So, in this groove, what you can identify? The tendons, all the four tendons of this flexor digitorum sublimis, right? So, this groove is laterally bounded by the palmaris longus tendon and medially by the flexor carpi ulnaris. So, this is the depression for the flexor digitorum. So, flexor carpi ulnaris determines its contour along the medial border of the forearm. So, when you flex your wrist against the resistance, you can appreciate the roundness of the medial border of the forearm. So, that is because of the contraction of the flexor carpi ulnaris. So, here what I told, muscles are not that much prominent, but their tendons by the contraction, they will form very prominences in the lower one-third of the forearm. So, what are those tendons? First, for which you have to do, wrist joint is flexed against resistance. Keep it in your mind, it is not a simply wrist flexion. It is a wrist flexion against the resistance. Okay, you should put a resistance in front of this hand, then you trying to flex your wrist. Okay, then you can appreciate very clearly, means demarcated tendons in the lower part of the front of the forearm. So, what are those tendons? If you see the most medial tendon, that is a palmaris longus. Just lateral to that, this is a flexor carpi radialis. Okay, so what is that? Two tendons very much prominent here. Medial one is the palmaris longus, lateral one is the flexor carpi radialis. So why I am stressing these two tendons? Because the important structures are present in between and lateral to the flexor carpi radialis. Can you guess what is that structure lies between the flexor carpi radialis and palmaris longus? It is a nerve. What is that nerve? Median nerve. Okay, so the space between this flexor carpi radialis and palmaris longus, you can identify in the deep groove, the median nerve. Then lateral to this flexor carpi radialis and lower part of the anterior border of the radius. This is the space where you can find the pulsation of the radial artery. Okay, so at the very lowest part. So here, just lateral to the flexor carpi radialis. What is the structure you can appreciate here? Radial artery. Okay, you can feel the pulsation of the radial artery here. So that's why if you want to see very prominent structures, you have to flex your wrist against the resistance. So then you can appreciate the two tendons very prominently. So the medial one is the palmaris longus and the lateral one is the flexor carpi radialis. So once you identify the flexor carpi radialis, medial to that nerve is there and lateral to that artery, that is radial artery. Okay, so this is very important here. So tendons of the flexor carpi ulnaris is along the medial side of the wrist. Here also you one tendon you can appreciate. So what is that? Tendon of the flexor carpi ulnaris muscle. So most medial border of the forearm. What is that tendon is occupying at the wrist? Flexor carpi ulnaris. So if you identify these structures, which are very, very important. So where the median nerve is compressed, because you see just beyond that, what happened? The median nerve passes through the tunnel. What is that? Carpal tunnel means it lies beneath the flexor retinaculum. Next, if you see on the posterior aspect of the forearm, so extension. See again, extension of the wrist and elbow. What happened here? If you identify the posterior aspect consisting of two longitudinal prominences with the presence of a midline longitudinal groove. Okay, so what are these two? Lateral and medial. So if you see on the posterior surface of the forearm, divides into two diverging longitudinal eminences. So what is this eminence? It is a group of muscles contraction. So what are those muscles? In the lateral eminence, it consists of brachioradialis. The most lateral border means the most lateral one is the brachioradialis. And beneath that we can identify extensor carpi radialis longus and brevis. And the medial eminence is consisting of the extensor digitorum and digiti minimum, then extensor carpi ulnaris. Here you see again extensor carpi ulnaris is most medial. Okay, so by contraction, that is because of the extension at the wrist as well as at the elbow. So what happened? We have two longitudinal eminences. So what are those two longitudinal eminences? Medial and lateral. The lateral is comprising of brachioradialis and extensor carpi radialis longus and brevis. Then the medial one is consisting of the extensors of the forearm. Okay. Then one more muscle here, anconius. In the upper part of the back of the forearm, just lateral to this olecranon, a triangular impression means that is a triangular, slightly elevated area. So that is because of the anconius muscle. Okay, so just lateral to the subcutaneous surface of the olecranon. If you identify this is a in extension, you can easily identify the apex of the acromion. Olecranon. Okay. So just lateral to that olecranon, you can appreciate a triangular elevated area. That is because of the contraction of the anconius muscle. So these are the muscles. So how to appreciate these are the muscles? See, by testing the muscles. So if you want to test the muscles, you should contract those muscles against resistance. Okay. So I told for flexors, you should flex the wrist joint or elbow joint against the resistance. Similarly, on the posterior aspect means extension. So extension against the resistance, you can identify the muscle groups or individual muscles. So this is about the surface anatomy of the muscles of the upper limb, right? Now we are going to blood vessels. So important blood vessels here I am taking, okay, not all the blood vessels. So what are the important vessels? As you know, the axillary artery is an important artery because it is continuous as the brachial artery. So to illustrate the axillary artery, so how to do means what are those landmarks, okay, on the surface of the body. So first point you should make at the clavicle, and exactly you see at the middle of the lower part of the clavicle. So first you make a point, first point at the middle of the lower part of the clavicle. Then second point at the anterior 1/3 and posterior 2/3 of the lateral wall of the axilla. See, this is the second point. So you should make a second point at the junction of the anterior 1/3 and posterior 2/3 of the lateral wall of the axilla. So if you join these two lines by a vertical line, see this line representing the axillary artery. Okay. So this line represents the axillary artery. Then coming to the brachial artery. So for brachial artery, point 1 is the axilla at the termination of the axillary artery, because the brachial artery is a continuation of the axillary artery, right? So the first point for the brachial artery you should keep at the junction between the anterior 1/3 and posterior 2/3 of the lateral wall of the axilla. Okay. Then where the second point? The second point in the cubital fossa. It is exactly 1 centimeter below the bend of the elbow. So first you bend your elbow. There is a horizontal crease. So just 1 centimeter below that, and it should be in the midline. Okay. So that is the landmark for this. What is that? Brachial artery. So if you join these 2 points, it will give brachial artery course. So at this second point, so we can feel the pulsations of this brachial artery, right? Then coming to the radial artery. See how to appreciate this radial artery. First point, you should keep 1 centimeter below the bend of the elbow. 1 centimeter below the bend of the elbow. That is the termination of the brachial artery. Why? Because at this point, what happens? Brachial artery is bifurcates or terminates into radial and ulnar arteries. So that's why the first point for the radial artery should keep at the cubital fossa 1 centimeter below the bend of the elbow. Okay. Then the second point is proximal to the wrist, lateral to the tendon of the flexor carpi radialis. Already I told how to demarcate this flexor carpi radialis tendon. Okay. Again, you should flex your wrist against the resistance, right? So then you can appreciate these 2 tendons. The 2 tendons are palmaris longus and lateral one is the flexor carpi radialis. So just place a second point lateral to this flexor carpi radialis tendon. Okay, so that is the second point. If you join these 2 lines by a curved line, so that gives the course of the radial artery in the forearm. Then from here, if you put a third point in the anatomical snug box, just below the tip of the styloid process of the radius. Okay, so just below the tip of the styloid process of radius. Then fourth point in the proximal part of first intermetatarsal space, and otherwise called space between the first dorsal interosseous. So these are the 4 points. If you make and join, you will get the entire course of the radial artery. So at this 4th point, what happened? The radial artery enters into the front of the hand, that is palm of the hand. Okay. Then ulnar artery. So for ulnar artery, same. The point 1 is 1 centimeter below the bend of the elbow, as it is another terminated branch, right? The point 2, lateral to the pisiform bone. So here, how to appreciate the pisiform bone? First, you identify. All of you see your palm. Okay. In the palm, 2 eminences are there. Laterally thenar eminence and medially hypothenar eminence. So, at the proximal part of the hypothenar eminence, place your thumb and compress. Then you will find out the pisiform bone. Okay, pisiform bone. So here you have to keep a second point. So if you join these 2 lines, it will give the ulnar artery. Then coming to the superficial palmar arch. So for superficial palmar arch, you should give a point on the radial side of the pisiform bone. So once you identify the pisiform bone, radial side means lateral to this pisiform bone, give a point. Okay. Then the second point on the hook of the hammer means that is just 2 centimeters below the pisiform bone. Okay. Then point 3 at the middle of the thenar eminence. Appreciate the thenar eminence at the middle of the thenar eminence. So if you join all these 3 lines, it gives a curved line, right? It gives a curved line that presents a convexity facing distally. So it gives a surface marking for the superficial palmar arterial arch. Now coming to the deep palmar arterial arch. So take a point just distal to the hook of the hammered bone. So again, how to identify hook of the hammer? So first you appreciate this pisiform bone. So distal to that pisiform bone means 2 centimeters distal to that. You will have a hook of the hammer. Okay. From here, make a line that is horizontal line from this point 4 centimeters laterally. That gives, but here it is a convex distally. So you should draw a curved line from where just 2 centimeters below means distal to the pisiform bone. That is nothing but hook of the hammer. Okay. From here, if you draw a curved line horizontally to how much distance? 4 centimeters. That will give deep palmar arterial arch. Okay. Now, some olive veins, not olive veins, superficial veins. I want to explain this median cubital vein. As you know, median cubital vein is very important. So, for the blood transfusion or intravenous injections, you have to make out this median cubital vein. So, on the surface itself, how to make out? You see, the median cubital vein direction you have to know. Okay. So, what is this median cubital vein? See, it is a vein. See, from the cephalic vein to the basilic vein. So, it is a communicating vein here. So, it communicates. A very best example for the communicating superficial vein. So, communicating the cephalic vein with that of basilic. So, what is the direction? The direction is upwards and medial obliquely. Okay, it is an oblique communication, not horizontal, oblique. So, from below upwards. From which side? Lateral to medial side. This direction. So that's why the knowledge of the median cubital vein, surface anatomy of the median cubital vein is very, very important. And the other superficial veins you can appreciate here. See, this is the basilic vein. Okay. Then this is cephalic vein. And a vein which is communicating with this median cubital vein. So what is that? Antebrachial vein or median vein of the forearm. Okay. So these are the veins which are important. That's why I kept this slide. Then nerves. Only these 3 main nerves I have kept here. Ulnar nerve, median nerve and radial nerve. So what are the points? What are the surface markings? First we'll see ulnar nerve. So for ulnar nerve, you see the first point is at the lateral wall of the axilla itself. So as all these nerves means derived from the cords. All the cords are related to the axillary artery. So that's why the first point you have to see for all these nerves is the junction between the anterior 1/3 and posterior 2/3 of the lateral wall of the axilla. Okay, that is the first point. And from here, make a second point at the middle of the arm, where the ulnar nerve pierces the medial intermuscular septum. So that is the 1 and 2. So if you join these two, it will give a part of the course of ulnar nerve in the front of arm. From here, the second point, what happened? Ulnar nerve leaves the front of the arm. So to where it is going? By piercing the medial intermuscular septum, it appears in the posterior compartment. So from this point, it appears onto the posterior aspect of the medial epicondyle. So on surface itself, if you roll your index finger just behind the medial epicondyle, just you roll. So where you can identify tender structure. Okay, so what is that nerve called? Ulnar nerve. So it lies just behind the medial epicondyle, means on the posterior surface of the medial epicondyle. Then from here, another point you should draw just lateral to the pisiform bone. If you join all these points, it will give the course of the ulnar nerve. Okay, ulnar nerve. Then coming to the median nerve. So median nerve, again the first point is junction between the anterior 1/3 and lateral 2/3. Means where the brachial artery arises, means that's the continuity of the axillary artery, right? So the first point at the termination of the axillary artery. Then the second point in the cubital fossa, but medial to this brachial artery. Then the third point at the middle of the proximal border of the flexor retinaculum. That is exactly between the two tendons. What are those two tendons? Just now we have identified. Medially palmaris longus, laterally flexor carpi radialis. Right? Medially palmaris longus and laterally flexor carpi radialis. In between we can find out median nerve in a groove. Clear? So just you join all these points, then you will get course of the median nerve. Then radial nerve. See, radial nerve course I have shown here in the front aspect only. So the first point here showing is intermuscular space. So what is that intermuscular space? Between the brachialis and brachioradialis. So here what happened? It divides into two branches, superficial and deep branches. Okay, so superficial and deep branches. The deep is nothing but posterior introitious nerve. It will passing through the supinator and it will extend onto the posterior aspect. But here the radial nerve is showing the course, means that is the superficial branch. I am repeating, what is this? Superficial branch of the radial nerve. So first point at the junction between the brachioradialis and brachialis. Okay, then the line should passes just medial to the lateral epicondyle. Then a second point 7 centimeters above the flexor retinaculum. So here what happened? It pierces the deep fascia, then it appears in the back and it appears in the anatomical snuff box. Okay, so as it is superficial branch, it appears the deep fascia to appear in the superficial fascia. So this is the course of the radial nerve. Then flexor retinaculum. It is also very important. So what is the knowledge about the surface anatomy of the flexor retinaculum? It is very useful in the carpal tunnel syndrome. So you have to demarcate the margins of the flexor retinaculum to relieve this carpal tunnel syndrome. Means that is the compression of the median nerve. So for which you have to know how to give incision to the flexor retinaculum. So for what? You have to know the extension of the flexor retinaculum. Clear? So what are the points? First, to make a point on the pisiform bone. Again, I am telling what is pisiform bone. Means where you have to appreciate this pisiform bone. Identify the hypothenor eminence at this proximal part. That is the, see, the proximal most part of the hypothenor eminence. If you place your index finger, you will get a bony landmark, bony prominence. That is nothing but pisiform bone. So for flexor retinaculum, you have to keep a first point on the pisiform bone, right? The second point on the tubercle of the scapula. Again, how to appreciate this tubercle of the scapula? So identify this thenar eminence. So at the thenar eminence, the summit here. So otherwise called root of the thenar eminence. Place your index finger and your finger is palpating one bony prominence. That is the tubercle of the scaphoid bone. So from the pisiform bone to the tubercle of the scaphoid, if you draw a horizontal line, that represents the proximal border of the flexor retinaculum. Then coming to the third point, it should be on the hook of the hammer. So hook of the hammer, if you want to palpate, just place your finger 2 centimeters below the 2 centimeters below the, means distal to the, not below, sorry, distal to the pisiform bone. That is the hook of the hammer bone. Then fourth point on the crest of the trapezium. What is that? Crest of the trapezium. It is also distal to this tubercle of the scaphoid. Okay. So if you draw a line between these third and fourth points, which represents the distal border of the flexor retinaculum. Okay. So the proximal border is curving upwards, means concave upwards, whereas the distal border is concave downwards. So if you want to draw, this is not exactly horizontal line, it is a curved horizontal line. Okay. So upper or proximal and distal borders of the flexor retinaculum. Then extensor retinaculum. See on the back of the wrist, it is not like flexor retinaculum. Okay, it is not like the flexor retinaculum. The first point on the lower part of the anterior border of the radius. First point on the lower part of the anterior border of the radius, lowest part, see. Then the second point on the tip of the styloid process of the ulna. So if you join these two lines, it gives a distal border of the extensor retinaculum. They make another oblique line, parallel and proximal. See, parallel and proximal to the this first line, and it should be 2 centimeters apart. Okay, if you draw one more oblique and parallel line 2 centimeters apart, so it will give a proximal border of the extensor retinaculum. Okay, so beneath this extensor retinaculum, we have altogether 6 compartments. So within the 6 compartments, the 9 tendons which are arranged. Okay, so what are those compartments? 6 osteotendinous compartments. That is also important question for exam purpose. Okay, so extensor retinaculum, these are the surface markings of the extensor retinaculum. So till now, I have explained about the what are the surface markings. So generally, surface anatomy means on the surface by vision only, means by ocular vision only, you can appreciate the prominences, means those are the bony prominences. Okay, then by contractions and against resistance, you will appreciate the prominences on the surface. Those are because of the muscles. Okay, then some of the important nerves, which usually the nerves are hidden, they are well protected by the muscles or ligaments. Okay, but if you roll over the bones, some of the nerves you can appreciate. Best example you see just behind the medial epicondyle. What is that nerve you can explain? The ulnar nerve. Okay, so just you compress this ulnar nerve behind this, you have a tingling sensation along the medial part of the forearm, then medial part of the hand, medial border. That is because of the compression over this ulnar nerve. Okay, so nerves you have to roll over the bones. Then vessels, we should demarcate some points, and some of the vessels you can feel the pulsations over the bones. So for which also you should have some knowledge, surface anatomy knowledge. Okay, so this is the topic about the surface anatomy of the upper lip. Please revise all this again. The surface points are important. So what I have mentioned only very easy points to demarcate each and every structure. Okay, try to identify. Then try to try your own self muscles. So by moving the joints against the resistance, you will appreciate each and every group of muscle and individual muscles also. Okay, so this is about the today's topic. Thank you.